I want to turn now to a health discussion here. We have a special window with some special guests. We're talking about leukemia, the type of cancer affecting the blood or bone marrow. One specific type now seeing a dramatic 55% increase in new cases really over the past decade. And what makes this particularly challenging is that some of patients with what's called CML may have difficulty finding a treatment. So this morning we are joined live here by Dr. James Dugan. He is an oncology specialist at Novant Health Cancer Institute in Winston-Salem. We also have Jen, who is a patient diagnosed with CML back in 2014. Good morning, guys. Thank you for joining us this morning.
Good morning.
Good morning, Jane. Thank you very much.
Yeah, absolutely. Great to have you for this important discussion. Let me start with you, Doctor. What is CML? What is this type of leukemia, and how does it differ from other types?
Yeah, let me give you a little bit of background. So chronic myeloid leukemia is a type of blood cancer, but more specifically, it's a disease of the white blood cells, part of your immune system. And these white blood cells have a very specific mutation in them called the Philadelphia chromosome, specific to this disease and really is manifest in CML. And because of this mutation, the disease is susceptible to a group of drugs called the tyrosine kinase inhibitors, or TKIs. And really that's what we're here to talk to you about today is through our partnership with Novartis, we're looking to increase people's awareness and education about CML and its treatments.
You said that, what I read was it's increased by 55% cases of this specific type. What is factoring into that?
Well, I think it's awareness of the disease, and also people are living with this longer. This disease is chronic, and the medicines that people will have to take, these TKIs, can be with them lifelong, so they'll be on them for years. A majority of patients will not reach their initial treatment milestone, so it's very important that we have these options in order for physicians to switch. If a patient is not tolerating it for one reason or another, about 14% of patients will need to change their TKIs due to other side effects, and really that's the need for various treatment options.
Jen was diagnosed back in 2014. Jen, take us back to that diagnosis and what that moment was like for you.
It was very scary. Leukemia had such a scary sound to it, and it was pretty frightening. But then I started taking the treatment, and for 8.5 years, I tried 3 different TKIs, and I had very strong side effects, and I was miserable. I was a cancer patient, and I couldn't work anymore. I couldn't do what I needed to do for my family, and people had to take care of me, and it was just very humbling and rough. But then I started Scemblix, and I'm not only working again, I'm actually able to take care of my family and really be the person I want to be, because this particular treatment has less side effects for me than it does than all the other treatments I've tried.
And that process of finding a proper treatment, it sounds like, that trial and error can be challenging for any little thing that we do in life. But what challenges did you encounter?
Some of the challenges I encountered was I didn't advocate for myself. I had all of these symptoms that I was really concerned about. I brought them up to my doctor, but he sort of blew them off and just kind of said, no, this is the treatment we're going to go with. So unfortunately, and it wasn't until my heart was damaged, my lungs were damaged by my treatments, that I began to advocate for myself. And now I have a doctor who works with me instead of just telling me what to do. And that, changes everything, I think.
Thanks, Jen. Doctor, what factors then do patients consider or doctors consider when selecting a treatment for CML?
Well, given the fact that we have a variety of options, Scemblix is just one of many. This drug is also known as asciminib, and it is approved for both newly diagnosed and previously treated patients with Ph-positive CML in chronic phase, which is the most common type of presentation for this disease. This particular drug has been found to have an improved efficacy at 48 weeks in recent clinical trials, and this efficacy is manifest in deeper treatment responses, right? As I mentioned, patients will have to stay on this potentially lifelong, and because of that, there are going to be certain side effects, right? And there are side effects associated with all of the TKIs. For this one, common side effects, lowered blood counts, increased blood pressure, maybe some GI upset. Certainly that is not an exhaustive list of the side effects that can be associated with this medication. And for more information, we urge patients to turn to learncml.com and to really have a conversation with their physician. Just to reiterate what Jen just said there, is that in order to find the right drug, in order to find through this trial and error process, to find the one that matches for you, you have to be able to advocate for yourself and discuss this with your physician. Everyone is going to have a different experience with these TKIs, and what may have worked for one patient is not going to work for another. The good news here is that people can live with this and return to their normal, healthy lives living with CML. And because of that, we should also focus on honoring their quality of life, right? We can do both things, find efficacious therapy and help people live with this better.
All right. Well said there. Dr. Dugan and Jen, thank you for joining us this morning. Definitely lending some insight on what this is and what people can do, and a testament to how you can have a good quality of life, even 10 years beyond your diagnosis. Thanks, guys.